Returning once again to the program is a good friend of ours. Dr. Sanjeev Sriram is the host of the Dr. America podcast. He is a physician, a pediatrician in practice here in Southeast Washington, D.C. He is also an assistant professor of pediatrics at the George Washington School of Medicine and Health Sciences, and the Dr. America podcast covers health, public health, culture, politics, the broad matrix of events and forces that relate to our individual and collective well-being. That's the way I put it. So first of all, Sanjeev, thanks for coming on the program.
Glad to be back.
Secondly, how did I do?
It was great. That was great.
Okay, you didn't have to say that, but okay, much appreciated. There are a couple things I've wanted to talk to you about. We haven't had you on for a while. One is you spoke at the unveiling or the rollout of Senator Bernie Sanders' Medicare for All bill. Miraculous breakthrough, a change in the times in that Bernie's longtime lone quest for single payer. This time around, he got co-sponsorships from 16 Democratic senators, which was very exciting for many of us. What moved you to speak at that event?
Yeah, so there were several things that really brought me to supporting Medicare for All. Obviously, my patients, and I think that their struggles have been something that have motivated me in a lot of my activism. But, another factor that played into my decision to support Medicare for All was just, really reflections on history. And the day before the launch of Medicare for All, Edith Windsor passed away. And she's a woman whose marriage was at the center of the Supreme Court case to legalize marriage for everyone in this country. And so Edith Windsor passed away, and she had only been married to her wife Thea for a couple of years before Thea had passed, and they had lived together and kept a lot of their relationship a secret. And just reading her obituary and just sort of getting to know her life, it left me wondering, what would I have been able to do for Edith when she was my age? What would I have been willing to risk? What would I have been willing to stand up for? Because I think it's easy to say that we're all for LGBT rights and that we support gay marriage in 2017, because a lot of the struggle for that accomplishment is behind us. It's in the rear view. And it's kind of easy to show up after a finish line to celebrate a cause, but it's much harder to fight for it when it's unpopular, even among the people who you would think are your friends. And I feel like, Medicare for All, I think, is much more within our reach than, gay marriage was in the 60s. But it does question, what are we willing to fight for? What are we willing to declare as our values? And, put our names and faces out there and, show some bold support.
Yeah, I think I think that's a great answer for a couple reasons, and for several reasons, one of which is that it has to do to me about courage, and it has to do with a willingness to challenge the conventional thinking of your time. I'm pretty old. With your trained clinician's eye, you can probably tell that I am not a young person. But one of the advantages of that is that I've actually lived through some of those transformations where I've seen ideas that were radical and crazy. And when Stonewall happened, and I was a teenager when the Stonewall riot announced the first public outbreak or uprising of the gay rights movement, people were just astounded. I mean, you did not go into a political fundraiser and say, hey, I love those Stonewall guys. You'd be thrown out. To speak to your point about LGBT rights, and a lot of other ideas that were definitely outside the mainstream have moved into it. But for example, people who talk about how much they loved Muhammad Ali, but they curse Colin Kaepernick or the other players taking a knee. Ali was much more extreme in his time than Kaepernick. So if you love Kaepernick, you don't love Ali. Yeah. So that to me means, among other things, let's how do we look into our hearts and really say, this is what I care about, this is what I want to fight for, even if other people say it's not.
Right, and and I think the other thing that I was looking at was really, the Kaiser Family Foundation had some really interesting data about people with insurance. It wasn't just the uninsured. I mean, it's the people with insurance where they're answering in surveys that half of Americans with insurance are worried about facing a $500 medical bill, which doesn't sound like a lot to like many Americans, but for many more Americans, that is a major, like scare out there, is that like, how am I going to afford the bills when the insurance company comes knocking? And these are the folks who have insurance.
Right.
And the more you dig into the data, the more you kind of realize that, we're not, for all the money that we've been forking over to the insurance industry, we haven't really been seeing a lot of health in return. And especially not the kind of like of health improvements that people who have been working their butts off deserve to see. And I feel like it has to move from one of those like academic discussions of, oh, there's been only this marginal, increase here or this little improvement there. It's got to be the kind of thing that if you are paying 3 times more than what you paid in 1999 for your family's health plan, you should be asking, am I 3 times healthier? Am I seeing 3 times better service at a doctor's office? Can I point to something?
And am I 3 times more financially protected? As you know, I have a background in this stuff too, a different kind, but policy and economics. And I feel very strongly about this, and I want to talk to you about this a little. One, the fact that the actuarial firm Milliman, I'm always quoting them because they collect these statistics every year, that a household, a family of 4, average family of 4 with quote-unquote good employer-sponsored insurance, PPO insurance, pays out of pocket for health care $11,000 a year.
Yeah.
11,000. Now, what's the average household income in the United States? You start to get into enormous percentages going for health care. People are not protected from health care emergencies. Right. A lot of people have the stories that I have of taking my wife to the hospital for an operation and being told in the intake procedure, oh, we need a check for $3,500, and being able to say. And when I said, I can't just, you can't just roll into the room and tell me I don't have that lying around. They, of course, weren't surprised, but the out-of-pocket costs, $500 for a medical emergency, we're not protected from that as a people.
And and to me, I feel like why I came to support Medicare for All was that I believe in its values, that healthcare should give you peace of mind when you go to the doctor's office. I think being healthy is already hard enough work as it is. The diagnoses that some Americans face are already challenging enough as it is. And to then have bankruptcy looming, is it going to hit you? Is it not going to hit you? That is something that, we shouldn't have that in this country. Like, we're better than that. And I just simply reject to its face this argument that we can't afford to give every single American and every person in this country high quality health care and not make them suffer financially for it.
Well, let's talk about the counter argument, because we have a class, I would say, and I don't want to put words in your mouth, Sanjeev Sriram, again, Dr. Sriram is host of the Dr. America podcast, but we have a professional class of doubters and naysayers, I would say, who adopt this world-weary posture of eye-rolling. They use their not inconsiderable intellectual skills to tell you why it can't be done instead of figuring out. I feel that if our intellectual class, and I'm not condemning everyone, of course, but there are a lot of people in and out of politics and academia who I feel if they devoted half as much intellectual energy toward figuring out how to do it as they do to telling you how not to do it. It'd be done already.
Right. And I totally agree on this. And this is actually one of the other motivations that I wanted to connect Medicare for All to some of our other historical challenges. The day that Medicare for All was launched was 55 years, almost to the day, that JFK gave his "We Choose to Go to the Moon" speech. And I feel like that is such an important moment of history to look back on, Because at that time, there were physicists who were describing, you have this many problems and challenges with gravity. Like the moon is hundreds of thousands of miles away. How are you going to keep astronauts alive? How many people are you planning on sending? How much is this going to cost? Like there were all of those questions. But then you found an American spirit of, okay, those are the obstacles. We've got blueprints that we could probably overcome a couple of those obstacles, but we've got other challenges that come up in the blueprints. But let's get to work. And I feel like that attitude of let's get to work, that enthusiasm, is what I would love to see for Medicare for All right now. Just because I don't disagree that there are obstacles. I feel that the descriptions that have been provided by the academics out there, I feel like they are fair descriptions of the obstacles that are facing us. But I refuse to believe that any of these obstacles are insurmountable. And I totally agree with you that we can't just settle for an eloquent description of an obstacle. We need to see some blueprints. And I get it that we don't have endless resources to try plan A, plan B, plan C. I get that. But I want to hear, okay, this is what plan A looks like. Here are some pros and cons. This is what plan B looks like, pros and cons. Let's debate. Let's take our time to figure out what we can do rather than sitting on our laurels of what we cannot do. And meanwhile, we have 28 million Americans who are still uninsured, uncovered, and they deserve better than what they've gotten so far.
And if you look, as you know, if you look at the OECD data, which compares developed countries' health measurements, we lag far behind, whether it's infant mortality, whether it's life expectancy, whether it's general state of morbidity or general state of health, on and on and on. The number of people who say they avoided a needed medical procedure because of cost. We are not number one. We are not first. We are not making America great in this. And so I guess here's a vision of leadership for you based on what you were saying. A president of the United States who gets up in front of the American people and says, we're going to do this and I want our finest minds to help me on this. And we are going to be reaching out to all of you to figure out how to get it done.
Yeah, and I think that is, kind of what we need to see from the intellectual class of this country. I feel like the great ideas and the great plans and methods and approaches are out there. I don't feel that any of this is insurmountable. And quite frankly, when people say that Medicare for All is unrealistic, I question what is realistic about the status quo. I mean, just like you were describing, we're not getting a ton of health improvements for all the money that's been spent. But we seem to be pretty settled that this is the best we got. I just can't, that does not rest well with me.
And I'll bet if you did a survey of the people who say that they would overwhelmingly have A, health insurance, and B, the ability to pay the out-of-pocket premiums and deductibles. So, but before I let you go, Sanjeev, Sriram, just a few closing thoughts are the other big crisis that we're facing and not talking about enough is Puerto Rico.
Oh, absolutely.
Which has been devastated by the hurricane. And it is, among other things, it is a human catastrophe, it's a public health catastrophe. What should people know and be thinking about there?
So there's a lot that can be and ought to be done for the people of Puerto Rico. From a medical and health standpoint, things are really approaching if they are not already a humanitarian crisis, there are going to be public health consequences for days, weeks, years to come. The island had somewhere around 60 clinics and hospitals operating before the hurricane hit. They are down to 11, and those are rapidly, declining because they are running out of power, they're running out of potable drinking water, and patients are dying. Children's hospitals do not function off of thoughts and prayers. It's simply insufficient. And we need to see some congressional leadership to put together a massive aid project. We need to see this problem be taken more seriously. It needs to be leading conversations among our political leaders. I mean, as much as I understand that, the NFL is a major cultural controversy, I feel that there are lives on the line in Puerto Rico that every time we're not talking and doing better by our fellow Americans and just our fellow human beings there, shame on us because we can do better than what they've gotten so far.
Yeah, well, we're going to talk more about, thank you for the reminder, because we're going to be talking about it more on this show for sure in the days and weeks and months to come, because it is a critical situation. So thank you for that. And Dr. Sanjeev Sriram, thanks for coming on the show. Where can people find out about what you're doing?
Yeah, so they can follow me on Twitter. My Twitter handle is Dr. Sriram, DrSriram. You can look up Dr. America on Twitter and it brings up my handle. From there, you can find my podcasts. They're on iTunes. On my Facebook page, I post a lot of material about health issues that are going on in the country and policies that we can have opportunities to do something about them.
Well, thanks for all the good work. And again, thanks for coming on the program.
Thank you.